Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning, it's a real treat, Dr. Mark Raphael. Thank you so much for being here, doctor.
Good morning, thank you.
You're welcome. So to get us started, March is Colorectal Cancer Awareness Month, very important. So what are some facts about the disease that you want viewers to know, doctor?
Yes, thank you. I think it's important to note that it's important to screen for colorectal cancer. That can be a life-saving effort on your part. Colorectal cancer is the second leading cause of cancer-related deaths in men and women. The CDC estimates that more than 50,000 Americans die each year, which can be more than 140 people a day. The lifetime incidence is up to 4 to 5%, and that increases with age. All races and ethnicities are at risk for colon cancer. There has been an increased risk among African Americans. There is a higher prevalence in those with inherited syndromes and/or family history of colon cancer and first-degree relatives. And I think it's important to realize that patients who develop colon cancer may feel healthy, and that's why prevention is key.
When we talk about colorectal cancer, any good news? Can this disease be prevented, doctor?
Colorectal cancer is one of the most preventable types of cancer, just like pap smear or mammogram. And what we do is find the small growths in the lining of the colon and rectum called polyps. And the goal is to remove those polyps so that those precancerous polyps can't develop into colon cancer.
Okay, so let's dig into this a little bit, doctor. Tell us about the screening and what are different types of screening and who should be getting screened?
Sure. So colonoscopy has been found to be the most effective colon cancer screening test, mostly because you can diagnose those polyps and remove them at the same time. There are other methods of testing. There's a fecal DNA testing, which is just via stool sample, and then less specific and sensitive tests like CT colonographies that can be done at different intervals. So as far as the age, it's been known to be age 50. More recently, data has shown to move to the age of 45, especially with the American Cancer Society and the United States Preventative Services Task Force commenting on that. And our GI societies are still looking into that to collaborate and confirm that data. So age 45 is the age for average risk, and age 40 for high risk, given a family history of colon cancer.
So I'm sure viewers are thinking, oh my goodness, do I have it? What should I look out for? So tell us some of the signs and the symptoms that people really need to look out for.
Sure. So I think the biggest alarm signs would be unintentional weight loss, altered bowel habits, diarrhea, constipation, especially abdominal pain, and the biggest alarm sign would be blood in the stool.
Oh, okay. So if you do see some of these warning signs, what should you do?
Definitely contact your doctor. Your primary care provider would be your first step, and we welcome everybody here at Covenant Digestive Care to be screened for colon cancer also sooner.
Well, doctor, I can just tell that you are so passionate about what you do. Can you tell us about your passion for treating patients and where that comes from?
Sure, thank you. I think saving lives is the most important thing. As gastroenterologists, we also see patients who are sick in the hospital, but these preventative care colonoscopy exams are really saving lives by removing those polyps, and it's good to stick to your routine schedule so you stay healthy for the rest of your life.
Well, your kind spirit and really comes through. So we appreciate you, and we thank you for all that you do for those in the community. Thank you for calling in today, doctor.
Thank you. Have a good day.
You're welcome. And if you'd like any additional information, head over to our hot links page. That's on WNEM.com.